Welcome to PT Microlessons, fast lessons with big impact. In this lesson, we'll introduce the basic concepts of electrotherapy and build a simple framework for understanding how it is used in clinical practice. As physical therapists, we use electrical stimulation for pain modulation, muscle activation, tissue healing, medication delivery, and functional movement. Understanding these concepts is important not only for clinical practice, but also for licensure preparation. Before we talk about specific treatments, we need to understand the basic settings. We can organize these using the FITT framework. Frequency refers to how often the stimulation is delivered. Intensity is the amplitude. Time refers to the duration of each pulse or cycle. And type is where we start. This includes the clinical goal, the current and waveform, and the response we want to produce. In practice, we often think of this as starting with type, then adjusting frequency and time, and finally intensity. To understand electrotherapy, we need to know the three main types of current. Direct current flows in one direction. Alternating current flows continuously while changing direction, and pulse current is delivered in individual pulses with gaps between them. These differences will affect how the stimulation is delivered and what settings we can control. Let's go over each one, starting with alternating current. Alternating current flows continuously while changing direction multiple times per second. There are no gaps between cycles. This produces a smooth sinusoidal waveform. Common examples include interferential, premodulated, and Russian current. Pulse current is delivered as separate pulses, with gaps between each pulse. Each pulse has a measurable duration. Because of these gaps, pulse current enables more precise control of settings, such as frequency and duration. This makes it very useful for many clinical applications. This image highlights the gap between pulses. These gaps are what separate pulse current from alternating current. They allow the tissue to rest between pulses and give us more control over how the stimulation is delivered. Direct current flows in one direction, with no reversal in polarity. Because of this, it has a higher risk of skin irritation or burns. Clinically, it is used less often, but it is important for applications like iontophoresis and some wound healing treatments. That's it for this PT Microlesson. Like and follow at PT Microlessons for more fast lessons with big impact on physical therapy topics.